Thank you. Good afternoon, everyone. I'm Dr. Rupert. I'm one of the doctors here at Auckland Hospital, and this is
Victoria. I work in Christchurch for ID.
And an absolute pleasure to be here today. We were just actually a little bit interested in where all of you were from. Yeah, anyone from the South Island?
God, not many.
Anyone from the North Island?
Beautiful.
Well, we've got the whole country covered, haven't we? Right. Right, yeah, and so what we're going to do today is talk in sort of more detail about vaccination for people with HIV infection. And the community came to us last year, after last year's update, when Dr. Joan Ingram had presented a detailed presentation on vaccination for people with HIV, because there were more questions, etc., to be dealt with. And so what we've done is we've put together today's talk, and it's based very much on the IMAC advice and schedule for immunisation of adults with HIV infection. So we're not talking about adolescents or children, and those particular issues should be dealt with their own clinicians. And as much as we'd all like a vaccine for HIV infection, we're not actually going to be discussing that or research into that area. And as always, if people have got uncertainty or need more information, they should clarify that with their healthcare provider, and can refer to the New Zealand Immunisation Handbook, which is the gold standard for information about this. And we hope to have a little bit of time at the end for questions and answers, don't we?
We do.
Right. Yeah.
So we've very much approached this thinking about the questions our patients ask us in clinic. So that's how we've looked at what we'll talk about. So if you've got other questions, just ask. Okay.
Yeah. I come from it too as from the perspective of a hospital doctor. So I work here in this huge ambulance at the bottom of the cliff. Auckland, New Zealand's biggest hospital, and I've spent a whole career dealing with health issues that could all be prevented. And as time goes on, I appreciate more and more about preventing infection and disease, and that's down to improvements in society, housing, diet, nutrition, and something that we can do in the medical area is vaccinations. And so these are one of the most powerful things that we can do to promote people's health. But we are asked,
first questions for
you.
you.
Do vaccines actually work with HIV infection? And yes, of course they do. And they're really important because they can protect people against really severe infections that don't have cures, such as hepatitis B, and more importantly can prevent against infection-related cancers. And two of the best vaccines that we have are the hepatitis B vaccine and the HPV vaccine that protect against liver cancer, anal cancer and cervical cancer. And this is very important for the individual, but we actually provide herd immunity. So if we vaccinate enough people, we can protect everyone in society from these infections. So that's great. Many people are worried that because they've got HIV infection, their vaccines aren't going to actually work. But I want to reassure people that actually, as long as they're on antiretroviral therapy and have a reasonable CD4 count, there will be a good response to the vaccine, and it will be effective. And if people have actually got a low CD4 count and are susceptible to infection, it's actually more important to have the vaccine to provide that protection that you actually need. But even with the best treatment, people with HIV infection are always going to have a slightly increased susceptibility to infection or these infections that cause cancers, and so it's really important to use these vaccines. Oh, Nurse Victoria, what vaccines have we got?
So we did print out some copies of the schedule, so
I'll take those
my
around.
assistant will hand those out. Today's session, I'll definitely have a look through the motu in terms of practically where you can go to get your vaccinations or talk to someone about getting your vaccinations. Just going to go through the IMAC fact sheet, because one of the things that I hear so often from people is they don't even, you don't know what's available. Like, what vaccinations are there for me? Where do I start? Where do I go? So the QR code will take you to the website that's got that document on it, but I am kind of old school and I like having a piece of paper, so that's why you've got them. So we'll whip through these, but essentially we're thinking about the things that you need to look at. If there's a green box, it means it's funded, okay? And I'll talk about costing in a wee bit. If it's green, it's funded, there's no cost, all right? If it's yellow, frustratingly, the evidence tells us it's really helpful and it's something that you should do, but it's not funded, which is frustrating. So we're thinking about hepatitis, so virus that affects your liver and causes long-term issues for people. And by issues, we're talking about cancers. Hepatitis B and C are the leading causes of people needing a liver transplant in New Zealand. Get a vaccination, prevent it, and you don't even kind of need to end up there. So then we've got HPV, which Rupert's just touched on, and it's hugely useful. The sooner we get it in life, the more effective, and we'll talk about that. If you're living with HIV, it is 3 vaccinations, so that's just something to think about if you're not younger than 27 and you are looking at self-funding. We'll talk about that. Flu vaccine, strongly encourage everybody to get this each year. The next 2 are meningococcal vaccinations, so that's thinking about protecting us against infections that predominantly cause problems for us in terms of our brain and the lining around that. Pneumococcal, we're thinking about lung infections, pneumonia specifically. Polio, we don't hear about polio now because we have polio vaccination and it works. And so the fact that we don't have polio in New Zealand is testament to the fact that the vaccinations actually stop it being a thing. Yep, it works. COVID, I think we've all heard large amounts about COVID vaccination. And then tetanus, diphtheria and pertussis is a combination. It's in the childhood schedule, as is hepatitis B and polio. So for lots of us, we have been vaccinated against these things, but we'll talk a bit more about how to find that out. And then lastly, we have a couple in terms of measles, mumps and rubella. And again, we see these infections in New Zealand, but not in the huge quantities that we used to, because we have vaccination and it stops people getting sick. And then we've got chickenpox as well, also in the childhood schedule.
So, Nurse Victoria, do I have to get all of those shots?
You don't. So I can't make you. It's not the way it works. Will I strongly encourage you to protect yourself against everything that you possibly can? Hell yes, at the end of the day. If you tell me that you've got a fantastic trip to Bali planned or you're heading to, somewhere in the tropics, I'll have a chat to you about travel vaccinations, thinking about hepatitis A or typhoid, possibly rabies or polio or cholera. And then now RSV's cropping up again, so we'll have a bit of a chat about that. The best vaccines are all free and you are all eligible for them. So take up the opportunity. Most vaccines don't need to be repeated, so once you do that initial series, you're sorted. Some, like pneumococcal, you'll see in there, you do have a booster after 5 years. But again, talk to your HIV nurse specialist or your doctor. We'll help you with these things, and if we don't know, we'll find out. The lost blanket book. This is so common. I don't know where my blanket book is. I suspect a lot of you don't either. Yeah, what is it? So, for most of us in this room, the old immunisation register doesn't have our childhood vaccination records on it because we're too old. So, I actually, when you come in and ask me and say, hey, have I had my hepatitis B? I can't look it up and say, yes, you have. So for some things, we can do a blood test, which will tell us if you've got immunity or not. And then depending on what that tells us, we'll give you your options. Now, there's a really good immunisation register. It's throughout the country. It's seriously fabulous. It's made our lives so much easier. We can print that out for you, so you've got your vaccination records if you need them for any reason. And your GP can also access that information, so it's readily available, or your community pharmacist if they're a vaccinator. If you're newly arrived in New Zealand, then you're not going to have a blanket book. And chances are, if you've come from areas of the world where conflict is a significant issue, you're not going to have health records. So this is where we just think about, what can we check? Do you think you've been vaccinated? Was mum not really into that kind of thing? Because that's the last patient I chatted to. She was like, mum wasn't into that. I've had nothing. And so we just started at the beginning. So in terms of where to get an immunisation, I emailed the Brains Trust around the country and my CNS colleagues and basically said, where do people who live in your region go to access vaccination? Because I think that's probably what a lot of you want to know. So have we look. Hopefully that's nice and easy to read. Just that disclaimer again, these only apply to accessing vaccines for people aged 18 and over. There's a few differences. So, SHC is sexual health.
Yeah, that's right. So here in Auckland, most of our people with HIV would access vaccines through primary health care. They would do that with their enrolled GP. Increasingly, I think some people are using pharmacies,
yep, that's on the
especially after COVID, and the sexual health clinic also provides some vaccines for STI. Yep. What happens in Christchurch, Nurse Victoria? Yep.
I think we've gone slightly rogue in Christchurch, and we offer the full schedule of vaccines, with the exception of MPOX, which sexual health does, in our routine ID clinics for any of our patients living with hepatitis or HIV. Really that's around the fact that for some of our patients, they're travelling a really long way. Like they're coming from Southland once a year up to see a doc in Christchurch, or it's really hard to get time off work. Rupert talked about seeing your GP. Bloody hell, getting registered with a GP in Christchurch at the moment is near on impossible. And so I think our approach is just kind of, we've got the facilities to do it, so we do. Yeah.
What sort of feedback are you getting from the community about that?
It's good. People like the fact that they can come in, see their doctor, get their bloods done, have their sexual health checkup, and while we chat about those things, that's their 20-minute post-vaccination observation time. So it does work really well, and I think it probably increases uptake as well, because it's convenient. You know, if I say to you, go and get your flu jab, it's a really good idea, and you're like, I'm going to have to go somewhere and find one. Whereas if I say, when you've come to your appointment, Hey Rupert, do you want your flu jab while you're here? You'll be like, yeah, all right, okay. And so you will. So I think access and convenience is a big thing. And that's why I've popped this information up here, because it is really important to know that you've got options and they don't all involve having to see a GP. Bear in mind, if you're getting your vaccinations at primary health, your GP's not doing them. It's the practice nurse. And if I was getting vaccinated, I'd want my practice nurse doing it, not my GP. So just thinking about that. There's also quite a few pharmacies now. One of the good things from COVID is the number of pharmacies that offer vaccination services, which is great because there's a lot of community pharmacies around. So it does make accessing these far easier for people. And some pharmacies, I learned, can also do your travel vaccines, which is brilliant because that makes it super simple. That QR code takes you to the New Zealand Book of Vaccines site, and it doesn't matter if you live in Kaitaia or Bluff, you will be able to see where your nearest place for vaccination is. Oh, it's more for me.
Yeah, but I don't want to go to the pharmacy. I mean, do you actually have to tell the pharmacist that you're positive to get these special vaccines?
No, you don't. And I think it's a really, really important question because for a lot of people, if you're using your local pharmacy who doesn't dispense your meds, they may not know your status, and so you're like, I actually don't want to do that with the person that I'm going to have a beer with at the pub tomorrow. However, it is a good idea. They are bound by confidentiality. They're a health professional, and so that should always be private information. But I also grew up in a small town, and I appreciate that what should happen doesn't always happen. And so as a realist, I'm going to say, no, you don't have to tell them, but you should. It is a good idea. And there's a note there, it is optional to have that vaccine information put on the immunisation register. I've not had anyone say they didn't want it, and I would find that conversation quite challenging, I think, because it's the layers of things that you have to do to get into it are extensive. Takes ages. You've got to have log-ons and separate kind of processes to actually, access it in the first place. It's super confidential. And having worked in a system that didn't have good access to vaccine records for patients and seen that may mean people need revaccination that they didn't need, I would really encourage transparency with that. I think it's a good thing. The other thing is just to remember, lots of us work in places where you may be offered flu vaccine, for example. Lots of workplaces or schools or universities and things will do those things. So if you are on the immunisation register, it means that when you come to see me in clinic, I'm not going to bug you about having your flu jab because I know you've had it, because I've checked before you've come in. So it's a good thing. Side effects. Don't like them. Don't want a vaccine.
That's right. So, I think the bottom line is that vaccines are very, very safe. These are some of the most studied and tested medicines that we have available, and I can reassure people that the vaccines that we're recommending are safe and effective for people with HIV infection. And I don't know how many times I've heard someone say, "Oh, I got the flu vaccine, then I got flu." Well, of course, because you're not going to be protected for 2 weeks, and you get flu or another virus. So, but I can tell you one thing: the vaccine didn't give you the flu, but you do need to get the vaccine in time to get the full protection. That's right. And then there's sort of expected and unexpected side effects, and actually, I think you need to expect that there's going to be a little bit of pain where the needle goes in, and actually it's quite common to have a mild fever or a little bit of fatigue after vaccination. And what this is actually representing is the immune response to the vaccine antigen.
It's a good thing.
And the development of antibodies. This is how the vaccine works and provides you protection. So, but actually, allergy, hardly ever seen. And if people do have egg allergy or allergy to other things, that can be managed usually with choice of vaccine. And it comes down to the skill of the vaccinator. If someone like Nurse Victoria is doing your vaccine, you probably won't even feel the needle going in. You may not even feel the fourth one going in. But there's some practical things to do. The vaccines may be intramuscular or subcutaneous, so do have it in the non-dominant arm.
I actually just say, don't get it in the arm you sleep on. You know, if you lie on your side, don't get your flu jab in that arm. Like, just be practical.
Right. And just be sensible. You need to maintain your fluid intake in case you get the fever. Don't go to the gym and do an upper body workout. And if perchance you're one of the small number that do have a more severe reaction, a fever or fatigue, usually paracetamol is all that's actually required. That's great.
So, should I get the COVID jab or the flu shot?
Yeah, go for it. Get them both. After all, it's not often you get something for free. Yep.
Not in this country.
And they will. It'll keep you well and out of hospital. And
how often do I need my COVID? I had one 3 years ago.
You need a new flu shot every year. And nearly everyone in New Zealand has had the primary vaccination series and a booster. But currently, people are allowed to access a booster every 6 months. And so as a new strain becomes available and the booster is updated, you can actually continue to update your protection for COVID. Now, that's not going to continue forever, and they're continually reviewing the recommendations for COVID vaccinations. But we are recommending a booster at the moment. But actually, there are other important vaccines for respiratory infections, and these are the most common vaccine preventable infections that we see, and so it's really important to actually get vaccinations for bacterial pneumonia. And Nurse Victoria mentioned the pneumococcal vaccination series, which is required for that, so it's a bundle of vaccines. The latest vaccine on the block is RXV, the RSV vaccine. It's not funded yet. It's licensed for people above 50 years, and you've almost certainly seen the direct-to-consumer marketing and advertising. It needs a lot of advertising because it costs $500, but actually it's an extremely good vaccine. One shot gives protection for at least 3 years against RSV, and RSV is one of the top 3 respiratory viruses. So this year in New Zealand, top has been influenza for hospital admissions, followed by RSV, and then COVID. Yep. So I'm recommending people in that older age group who perhaps at risk of complications, so perhaps asthma, chronic respiratory disease, to seriously consider investing in it. Yeah.
So I need a shot for STIs. What do you have?
Well, actually, we've got a lot of vaccines for sexually transmitted infections. And look, just remember that. Intimate contact is a way of communicating a large number of infections, but we're specifically talking about the infections that can be transmitted through sexual practices, and I actually recommend a bundle of vaccines for all of our patients with HIV infection, and for men we'd recommend hepatitis A, hepatitis B, HPV, Mpox. And now,
meningococcal.
yeah, meningococcal, that's right. But actually we don't have vaccines for syphilis, chlamydia, HSV, and so there's actually a role for condoms and doxypep to provide protection against those other infections.
So they're all just different things that you can have in your toolbox. Yeah, what about that new vaccine for gono that I saw on the BBC?
Yeah, that's right. It's so very topical. In fact, there isn't a vaccine for gonorrhea, but what we do have is a vaccine for meningococcal B, and it looks as if that provides useful cross protection for gonorrhea. And this is all based on research conducted here in New Zealand by Dr. Helen Pertussis-Harris and colleagues that showed protection against gonorrhea for young people being vaccinated for Men B. Yep. Now, there's been a large number of studies now looking at these cohorts, and they estimate that the protection is somewhere between 30 to 60%. So it's not fully protective, but it's at least partially protective. What we don't know is how long that protection will last for, so it's probably very important to have the regular booster to maintain protection. And so so that's being recommended in the UK. They're recommending that for all men who have sex with men who are at risk of STI, so STI in the previous 12 months. The situation here in New Zealand is we're providing that bundle of vaccines for people with HIV infection, yep. And not actually for MSM. So, but there will be people in the community who can access Men B, or actually purchase it if they want to get that protection for gonorrhea.
So, not in my 20s anymore. Is it worth paying for the HPV?
Well, it depends, doesn't it?
Yes, it does.
Because it's a relatively expensive vaccine, but it is actually licensed and probably effective up to at least 45 years. And when we look at the increased risk for HPV and anal cancer amongst people with HIV infection, even partial protection is going to be beneficial. So I think it's a very reasonable decision to make, and would certainly provide that if someone wanted to proceed. At this stage, we're still recommending 3 doses, so that's the full vaccine schedule for people with HIV infection, whereas actually 1 or 2 doses is sufficient for adolescents. It may well be that we have enough information in the future to drop that down to 2 shots for people with HIV infection.
Still 3.
Which would make it cheaper.
It would.
Yeah.
So we've kind of answered this on that initial slide with the map of New Zealand on it. And it very much depends where you're living in terms of where you can access Mpox vaccination. But the easiest answer is your local sexual health clinic. And I realise that your local sexual health clinic may still be a couple of hours away. So that can make it slightly more difficult.
Yeah, it's we're actually lucky. There is still a good supply of Jynneos vaccine for protection against Mpox, and it will be easier to access now that it's registered. I think it's important to point out that although you can use the Jynneos shot after an exposure to Mpox to try and prevent development of infection, it's actually much more effective to have the full course of shots beforehand, where you get approaching 90% protection against Mpox. So we're really recommending people do that. I think there have been 2 dozen cases through
Mm.
New Zealand in recent months, so it's an ongoing risk.
Yep. We've definitely had a cluster in Canterbury, so it's not just the North Island.
Yeah. And we are recommending it for travellers too, depending on what sort of holidays and activities they have planned. Yeah.
So are there some new vaccines, or is all of those what we've got?
Well, the most recently funded vaccine was the Shingrix vaccine, and there's nothing in the wings at the moment that we're expecting to be added to the schedule. But Shingrix is actually a very good vaccine. So this is an inactive recombinant vaccine for shingles, and is actually recommended and safe for people with HIV infection and immune compromise. And now it's approved for general population greater than 50, and for people with immune compromise greater than 18. But the funding criteria are a little bit difficult to interpret here in New Zealand, and so for the general population, they're able to access the vaccine in the year they turn 65.
Yeah, super tight.
Very, very tight, but actually. The criteria does allow us to prescribe the vaccine for anyone with HIV infection from age 18, and but that does require some discretion from the prescriber or vaccinator. And so we would encourage our patients to ask for that.
Yep.
Well, that's a pretty good
quick tour of
Cook's
vaccinations.
Tour, isn't it? That's right. And as I always like to remind everyone, an ounce of prevention.
Pound of cure.
That's right. Yeah, right. Well, I think we're right on time, Mark. But do you think there are any burning questions?
Great.
Couple of questions. Rupert, isn't there a CD4 requirement under a certain level for the Shingrix vaccine in HIV?
No, there isn't. So in some countries, they have a CD4 recommendation for eligibility. Here in New Zealand, the criteria is a poorly controlled HIV. So this gives people clinical discretion to work out who will benefit from the Shingrix vaccine and then prescribe it. And because actually, even the which CD4 count is, it's tricky, isn't it?
There used to be, which may be what you're thinking.
So the live attenuated vaccine, of course, could only be used in people with a normal CD4 count, viral suppression.
And second question, the Kirby with Andrew Gillick, they're very keen on any MSM getting an HPV vaccine to any age, and even one is better than anything.
Yeah.
Mm-hmm.
So,
yeah, we agree.
And yeah.
Thank you for that excellent summary. And I wonder if you could comment on MPOX to prevent hospitalisation as well as acquisition. So, as you've said, there's an active epidemic in Australia, and we do have cases here. The evidence seems to be that, yes, it's protective against acquiring, but particularly to reduce symptoms and keep people out of hospital.
Yeah, I think that's a very, very good point. The vaccine it doesn't provide perfect protection against mpox. This is the smallpox vaccine that provides cross protection. It provides very good protection against developing a disease, but there are a number of people that will have breakthrough after a full vaccine course. But in fact, those breakthrough infections are much more mild and more short-lived. And almost never cause generalised mpox. So I would, I would call that a very good response to the vaccine. Yeah.
Where are we at with using the Bexero, or suggesting that people are getting the Bexero, like MSM or sex workers or anything, to protect against gono at this stage?
Yeah, that's certainly a discussion worth having. A little bit out of scope of our discussion today, and the Men's B vaccine is currently funded for quite a large number of groups actually. So but not specifically for people in the sex industry, but actually children, adolescents, people with chronic conditions, immune compromise are all eligible for it. But I can see a lot of areas where it would be useful otherwise. And,
At the moment, you'd find something else in the criteria to make you eligible and access it that way. Yeah.
Okay, good. Kia ora. One good news is that soon at Body Positive we're going to be doing some vaccines. So it's one good. I've noticed with a couple of our members at Body Positive who are living with HIV have been struggling getting the pneumonia vaccine. Is there like some sort of criteria where they have to be immunocompromised, and does that?
What are they struggling with? Is it finding somewhere that provides it? Or is it
the GP actually saying, no, this is not funded for you?
often it's a knowledge thing in terms of the GP, and that's why we've given you the link
knowledge
to the schedule and the power to actually say, actually it is for me and it is funded, let me show you. Yeah. Because like, knowledge is power. And I get lots of queries from our patients with that exact same issue. And so now that's the easiest way to address it. It's education, and if you can provide the GP with the education, then they know that for the next person. Yeah. 100% it's funded. Yeah. And that also means, so I should have said, and it was on that one of the slides, but if you are on the schedule as funded, that means you're funded no matter where you access that vaccination. So if you're going to your local pharmacy, it's also free. So it's really important to just know that. It's not going to cost you more if you go to your pharmacy or if you come and see us or go to sexual health.
yeah, and no, that's great. The Body Positive is starting some vaccines.
So good.
So I hope.
I love it.
Mpox, I hope, is going to be available. And
We do Mpox on Tuesdays now, and then hopefully when we get the nurse, we'll be able to do Mpox every day.
Doesn't matter. It doesn't matter where you get the vaccine,
No.
as long as it goes into the arm, Nurse Victoria.
It does, Doctor.